Good afternoon, everyone. Thank you for joining us today for our sixth session of the Elder Justice Lunch and Learn series. I am honored to have you here with us today as we go into the holiday season, particularly that holiday where we're here in America, we express our thankfulness for everyone. And I want to say, as we kick off today, I'm so thankful for the community we have built here. My name is Nicole Howell. I'm the Executive Director for Ombudsman Services of Contra Costa, Solano, and Alameda, and I will be your moderator today. As a reminder, we really think of this as a community and value your input. So please start thinking about ways in which you can engage. Start writing your comments in the Q&A and chat. Dr. Keebler has left lots of time for interaction today. But the way we like to start off is I like to ask everyone to go ahead and drop their name in the chat and say what you do. So tell us your name and sort of where you're from and what job you do. It helps us to understand our community and I think see the breadth and depth of the work going on out there, both in California and well beyond. As a reminder, we do value accessibility and you can use the closed captioning function. Along with, we have American Sign Language available in the Zoom feed. So thank you so much to all of you who come to us. And if there's more we can do to make it accessible, please let us know. As I said, this is our sixth session of the Elder Justice Lunch and Learn series, and we will be meeting next month on a different day. So next month, we'll be meeting on the second Thursday of the month on December 10th. So please mark your calendar for December 10th at 12 p.m. And as a reminder, we drop the registration in at the end of the webinar. So if you stay to the end, you're the first one to register. This is a production of my organization, Ombudsman Services of Contra Costa, Solano, and Alameda, but we could not do it without a host of partners. And I think today is particularly important as we are joined by a physician with Kaiser Permanente, and they have been our generous sponsor for this year of webinars. And so today our sponsors are Kaiser Permanente, along with distinguished planning partners like California Department of Social Services, California Commission on Aging, California Long-Term Care Ombudsman Association, the Office of the Long-Term Care Ombudsman, California Department of Aging, and California State Association of Public Guardians, Public Administrators, and Public Conservators. Now, today, I am pleased to bring you the distinguished Dr. Keebler, who is a physician of Geriatric and Palliative Medicine out of the Kaiser Napa Solano office. And Dr. Keebler is going to talk to us today about, I think, the issue we're all feeling, which is how do we prevent isolation, depression, and issues of general, the fatigue we're all feeling as we're 6 months into this, or 6 to 8 months into this pandemic, and how we can ensure that our clients are still feeling engaged, even if we are not able to be present with them. And this is especially important as many of us in California this week rolled back to a more restrictive tier of access and being able to be out in the world outside our home. So Dr. Keebler, I am pleased to have you here with us today. I want to say again, thank you to Kaiser Permanente for making this webinar possible and also for providing us such a distinguished speaker. So Dr. Keebler, I turn it over to you.
Thank you so much. Hi, everyone. So I'm Dr. Chandra Keebler. I'm a geriatrics and palliative care physician, as Nicole said, for Kaiser Napa Solano. We're in the Northeast Bay Area in California. My main responsibilities at Kaiser include working in our memory clinic, as well as visiting homebound elderly patients in their homes. I also work in the skilled nursing facilities, both for patients who are rehabilitating from the hospital as well as long-term residents. And I also work with our hospice patients and families as well. So today I'll talk about an important topic for all of us to be aware of as our pandemic enters its 9th month and is likely to last many months more. And that are the impacts of the isolation that we all have experienced during the shelter-in-place orders, but have affected our elders the most. So you'll see our agenda here. I'll show everyone how social isolation and loneliness are proven health risks. I will talk about an updated toolkit to support our elders during these unprecedented times, and we'll talk about the holidays as well. We can go forward, Nancy. So we know intuitively that social isolation and loneliness can't be good for our health, but there is evidence behind this. Social isolation being the objective state of having few social relationships or interactions. Now, this affects about a quarter of the community dwelling 65 and over population. Please note that I said community dwelling, which is not including the vast amounts of our elders who are residing in facilities that likely have quite restrictive visitor policies, as well as reduced interaction from the staff at those facilities. And we know that there's more frequent caregiver burden happening as well, both at home and in these facilities. And so I would argue that it's likely much more than a quarter of our facility residing population that are experiencing social isolation, as well as loneliness. Loneliness being the subjective feeling of being isolated, regardless of how many people are around. That can make us think of depression, anxiety, and cognitive impairment, which is often gradual in onset. And many people with dementia or cognitive impairment are seeing a more rapid decline related to the recent isolation. I see it in my practice every day. So looking at the data and statistical analyses that have been done, I'm sorry, we'll just go back for a sec. These factors have been associated with a significantly increased risk of premature mortality from all causes. So it's actually been compared to risk factors like smoking, obesity, and physical activity. So my colleague says that sitting is the new smoking. Well, I think social isolation and loneliness are right up there. And we need to focus on these issues to improve well-being and quality of life for our elders. And I know that's why we're all here. So just pause for a moment, everyone. I'm seeing kind of the list of everyone who's here today. I'm so impressed by all the work everyone is doing. But I want you to think about an elder that you recently connected with, or perhaps even someone in your family. Many of us have loved ones who we support at home. So think about these topics as we go forward and how they might affect that person. All right, so we are here. If you're in the US, you're located right there where that red dot is pointing. We're well on our way into our third wave of the coronavirus pandemic here. There are large numbers of individuals filling up hospitals. It was just focused in the Midwest and South, but now we'll see a little bit later, it's all over the country. You may have also heard about this unexpected deaths number. So the CDC, we'll talk about it a little bit later, but the CDC counts how many deaths that there are each year, and we're seeing a lot more deaths this year. There we go. You might think that, that's not very surprising that more people are dying this year, but coronavirus does not account for all of those excess deaths. So we have to think about, what is causing it. These could be undiagnosed cases, but also secondary effects from the pandemic and coronavirus. So just some things I want to point out here. 78% of COVID deaths were in those of age 65 and older, and a fifth of those deaths were in nursing homes. When you look at the age breakdown of increased deaths this year, there have been a 24% increase in deaths of people aged 65 to 74. And it's really important to point out here that people of color are disproportionately affected by the coronavirus. So the Latinx community saw a 54% increase in deaths this year, 54%. The Black community saw a 33% increase in deaths. In American Indians and Alaska Natives, there was a 29% increase. And in people of Asian descent, there was a 37% increase in deaths this year so far. Now, comparing that to white people only had a 12% increase in deaths this year. So it's really important to keep that in mind. We can go on. So here we are in the US, not doing too well right now. As of Tuesday, when I updated this, there were 11.4 million cases, over 116,000 cases in the US on Monday alone. I'm sorry, we froze just a little bit. Okay. 55.5 million cases reported worldwide, and over 536,000 cases reported on Monday worldwide. Now, this is a 16% increase compared to 2 weeks ago, and average deaths have increased 35%. So gosh, times are tough right now, everyone. And if we move forward one more slide, we'll talk about things in California. So we're based here in California. I know we have viewers across the country and the world, but we're working on a tier system based on a couple of statistics, such as the positivity rate. And as you can see, most of California has slid back into the purple. You might have read about the restrictions that are being imposed again, and hopefully they will be taking place quickly enough to attack this third wave. Okay. So this is when we reminisce about all of the pre-COVID activities that we used to enjoy. We enjoyed the support of senior centers, our communities, activities such as churches, family gatherings, as well as the services of respite, in-home caregivers, and adult day centers. So a lot of these supports are just no longer available because they're not safe. Meals on Wheels are on here, but they're still running right now, and we'll talk about that a little bit later. But sorry, can we just go back a little bit? So many of these supports are just no longer available, and that creates a difficult situation. And we can move forward. Sorry about that. Just want to make sure I covered everything. So have you ever heard this in the talk bubble? I'll just wait until this whole COVID thing is over. I've heard that a million times. I'll just wait to get my colonoscopy. I'll just wait to place mom in a facility. I'll just wait to hire caregivers until this COVID thing is over. Well, we know it's not that simple, and we need to find a balance. We've been doing this for 9 months here in the US now, and longer in other places. We need to think about the medium and long-term secondary effects that social isolation itself can cause, and weigh those as real factors against contracting COVID and now nowadays the flu. So trying to wait out the pandemic just isn't going to be realistic for some of these important issues that we're talking about today. So these are just a few of the factors that we assess in every geriatric evaluation, but especially in those who might be socially isolated. A lot of my patients are socially isolated just to one degree or another. And so we think about these issues. We'll come back to these and brainstorm together. So hopefully I've proven to you that social isolation and loneliness are important health risks and something that we can work together to address. So what we need to do as professionals and family members who care for and support our elder population is to update the toolkit that we've been using. We're in a new normal now, so that requires new tools that target these issues of isolation and loneliness. So this is really basically what a really good social worker or case manager would do, and we do have a national shortage of those. So this is my crash course, my best attempt at equipping us all to address these needs. So we'll go through each of these, reassessing our resources, identifying the needs, and taking action. We have to piece together an appropriate level of support for the individual person. There's not a one-size-fits-all approach, right? So I tell my families that everybody's solution is going to be very individual based on the available resources and what the situation is. So in geriatrics, we strive for an interdisciplinary team that usually consists of a doctor, a nurse practitioner, a social worker, a pharmacist, and a medical assistant. This allows us to provide multidimensional care to our patients with complex needs. So we're always looking at the whole person, assessing for areas of improvement, and I think that we can apply this multi-dimensional approach to this problem that we're talking about today. So, what family members and friends are available to assist with the elder? Are caregivers an option, either paid or unpaid, or compensated in other ways? What community-based networks are available to provide support, such as Meals on Wheels and certain senior centers that might be open? And then, of course, involving the providers. So the primary care provider is a great resource. Specialist providers such as a geriatrician or a memory doctor, psychiatrist, and you. So, thinking about your own role and how you interact with elders, what can you add for the person in question? And I know the elder population is not always up to date with technology, but this is a great opportunity for the family to get involved. A lot of my patients are learning how to do video visits with me, or having their, enlisting grandchildren to help with the technology piece. And not only can that help the elder connect with their doctors, but of course family. So video chat is a really great thing. If a lot of people feel a little awkward on it, but if you try it, you'll find that, gosh, it truly is a nice way to connect with people. Simple things such as phone calls or texting an elder can help them feel more connected. I have a lot of family members who actually send letters and cards to the facilities that aren't allowing visitors. So that can be a really nice thing. And believe it or not, our elders can learn to play video games. I have a patient with, pretty severe dementia, who has a lot of behavioral issues and mood problems. And he actually loves to play video game golf with his son. So it's probably one of the few moments of normalcy that he gets in his day, is when they get to play together and just have some fun. I also know that, for Kaiser's members, we have a health education department who can walk people through, how to sign up for these things. So let's go back to these factors that we looked at earlier and talk about how we might address each one. So looking at low appetite and weight loss, this is so common, especially if we're socially isolated. We may not be cooking for ourselves. We might not feel as hungry because we're not moving around. And I'm seeing a lot of low intake and a lot of weight loss in my patients. So again, delegating family assistance, assessing these nutritional habits. Are they skipping meals? Are they waking up late so they're only having, 1 or 2 meals per day? Is it just too much of a bother to fix food, for one person? See if you can organize a socially distant meal, perhaps, with loved ones. And then, of course, Meals on Wheels is a great option. Excuse me. So for medication problems, you might not even know that there are medicine problems, but they can actually be behind a lot of the symptoms that a person could be experiencing, such as dizziness, lightheadedness, and even falls could be caused by medication issues. So the first thing to do would be figure out what this person is taking, make a list, perhaps review it with the doctor. And something that I think everyone could do is just find out who's filling the pill box. Is there a pill box? How is this person taking their medicine? What is their organizational strategy to take all these pills every day? I tell all of my patients that at least one other person should know their pill regimen and their organizational, where everything is, just in case there's a day where, they're just not up for doing it, or they might have memory issues and need some assistance here. there's a lot of weakness and decrease in abilities right now with the social isolation. One of my patients said, I was doing so well. I was going to the gym 5 days a week before COVID, and now I can't go at all. But, it's been 9 months. We need to find a new routine. Just waiting it out, like I mentioned, is not going to be a good solution for us. So making a new routine, incorporating physical activity into the everyday, adapting exercise to what is possible is really important too. So, a person doesn't need to run a marathon or even walk around the block. I say chair exercises are great. They still get our blood pumping, and that is what is important. And that can also assist with some of the depression and mood changes that we definitely see nowadays. I want to tell another story about a patient who I saw for memory in his home via video, and his bedroom was on the second floor. Now, he has mobility problems, and they do have a chairlift for the stairs, but, it's kind of a hassle, and he didn't really feel like doing it. He had oxygen and everything. So he's spending weeks at a time upstairs in his bedroom. And I told them, that is a problem. We need to get some more sun exposure here, some fresh air and some sun. I know that's very low tech, but these are our basic human needs. So we need to really work on that for our elders. I'll tell another story later, but involving the primary care provider, considering medication, there really is nothing wrong right now with considering that, even if you had never considered medication before for depression, anxiety. And then, of course, the technology that we talked about, connecting with family, making sure that we have some social interactions. And then memory changes. We have to talk about that. So, the pandemic, the social isolation will definitely accelerate any memory problems that are already present. And sometimes they uncover problems that we didn't even know were there in the first place. So something important to know about memory loss, and especially dementia, is that we compensate for it. It can be very slow, gradual onset. And as that happens, we figure out how to deal with it, maybe even unconsciously. But then when something like this pandemic hits, it's kind of a big, unexpected change in life, then our ability to compensate for this decreases. And that's when we start having, family members come in saying, she was perfectly normal before March, and now, she doesn't recognize her own home. That's a real example. If you just advance one click, I think. So I want all of you who interact with facilities to think about this. What is the policy at these facilities for visitors, getting residents outside, and perhaps more lenient restrictions for hospice patients? Right now, as I mentioned, a lot of our counties in California are sliding back into the purple, which means really no visitors should be allowed at these facilities. But what can we do? What changes, what staff education can we provide to help these elders connect with the outside world even during these difficult times? So I just want to share, I went to a memory assisted living, kind of a smaller facility, to help one of our nurses give flu shots. So they were bringing up the patients to the front door, and we would give them their flu shot right outside the front door. And more than one of these residents remarked how amazing it was to breathe the fresh air, to see the outside world. This was just the parking lot of the facility, but more than one person remarked that to me, and I thought, wow, this is a really good facility. I feel really happy when one of my patients is placed here. But even this facility that I have a lot of faith in, is having difficulty getting their residents outside. And a lot of it is a staffing issue, time, safety, and all of that. But I would argue that we need to figure out a solution in order to help our elders reach some level of normalcy, even though they might be residing in a facility. Okay. So an updated toolkit, you can advance a couple of times. So it's really important to get our people power, who are going to be our boots on the ground for our elders. How can we better use technology to assist and decrease the social isolation and the loneliness that our elders are feeling? And not only that, but kind of addressing these medium and long-term secondary effects that the isolation has caused. And I think there's one more here, and that's just doing something about it. So, we have to piece together this support system for each individual, and it's going to look different for everyone. Go ahead. Okay, so we need an updated toolkit, and I think we have some ideas on what to fill our toolbox with. And next, I want to talk a little bit about the holidays and how to navigate that, not only for our elders, but probably everyone's wondering, what the heck do I do? So let's see. Knowledge is a part of our toolkit, and we need to know what we're working with. So things to consider: what are your community levels of COVID? So you can look that up no matter where you are. Your county likely has a website with a dashboard that tells us what the community levels are, and what the test positivity rate is in your county. So generally, a test positivity rate above 5% will kind of result in, a ongoing increase in the number of cases and the burden on the healthcare system. So you'll notice, way back in the California tiers, that 5% and above is I think it's the red, the second to worst, and then 8% and above is the purple widespread. That means this is out of control. We really need to act now. Unfortunately, a lot of places across our country, the US, are kind of haphazardly imposing restrictions and maybe even incompletely. So it is important, of course, to follow our guidelines from our local governments. I would also argue that we need to think for ourselves and know that the restrictions might not always be in our best interest, and maybe we need to be a little bit even more careful than what the restrictions say. If you're thinking about having a gathering, where will it be? How long will it last? And how many people will be there? These are all factors that will affect our risk of contracting COVID or the flu, or even, other illnesses. So, you might have heard of bubbles or pods, and you might be part of one yourself. If you haven't heard of that, a pod is a group of households that have agreed to interact with each other, but avoid interaction with everybody else, basically taking extra precautions with people outside the pod, but allowing interaction within. And that can be helpful in families with children or elders, people who really need that interaction, which I would say is most of us. And if you're having out-of-town guests, I would advise a lot of caution. This is really not the year to have out-of-town guests for the holidays. There are some ways of making it safer, which we'll talk about, but if you're not sure what to do, it is better to err on the side of not traveling for the holidays, especially not on planes. Consider where the guests are coming from and their safety habits. These can be really awkward conversations and really difficult decisions because everybody has a different level of comfort, with what's going on. But this is the world we're living in, and we have to make good decisions. And this will not last forever. There is an end at some point. I don't think it will necessarily be an end like the end of a movie, it's over. I think it will be a slow transition back to a post-COVID world. I don't think we'll be going back to pre-COVID. But anyways, we know in general that small outdoor gatherings are preferred. They're safer to be outdoors and with not too many people. If you've heard of super spreader events, these are events that are usually large and with a lot of people talking indoors, and then a lot of people end up getting COVID. We've heard these really sad stories of weddings, funerals, and birthday parties that lead to cases of COVID sometimes sometimes multiple in the same family. So we really just don't want that to be our Thanksgiving or our holidays. You know, I have seen on social media some, I guess, some opinions that, you know, you never know what holiday could be your last. So go ahead and get together with your family. And I would say, you know, I don't think about it that way. I think we need to be safe this year so that next year we can get together and we'll all be here. Okay, so lower risk activity. Now, this is all from the CDC, so don't write this down or memorize it. But generally, this is doing the same things we've hopefully been accustomed to doing, staying home, using technology, hand washing, mask wearing, all that good stuff as keys to success for our holiday season. So these are just some ideas. So, you know, having a dinner just with your household or just with your bubble or pod, thinking outside the box for the holidays, you may be making your favorite dishes and sharing them with neighbors on the doorstep and running away so that you don't interact. Having a virtual dinner, so setting up your laptop at the dining table. And I really urge everyone to avoid in-person Black Friday shopping this year. We don't need any stampedes at Walmart this year, okay? And same with all the other holiday events that we enjoy. We can enjoy those from home. There are, like I mentioned, there are ways to make a slightly larger gathering safer, keeping it outdoors. You know, perhaps your visitors were able to quarantine for 2 weeks before interacting. Not everyone has that time, but that can help. And then going to outdoor events that allow for social distancing, mask wearing, and hand washing. So, you know, a pumpkin patch that really keeps these protocols in mind, outdoor activities like that, people like to do during this time of year. And this one was actually labeled higher risk activities, but I'm gonna say just say no to large indoor gatherings with people outside of your household or bubble. No to in-person shopping and crowded events. You guys might remember the Sturgis Motorcycle Rally. This is a 500,000 people rally that occurred in August in the US. I think it was South Dakota. And we don't even know how many cases of COVID that led to because there just wasn't enough contact tracing. But I actually saw a map of the cell phone data, and gosh, those people came from all over the country. So we want to learn from this and try not to repeat those mistakes. And then, of course, alcohol and drugs do cloud our judgment. We might have a few glasses of wine and think, well, you know, what's the big deal? Let's go hug our neighbors. So just be careful about that. And people who should really just stay home during these holidays are people with a diagnosis or symptoms of COVID. If you haven't been cleared by your doctor, you really have to get the okay from them to make sure you're kind of good to go back out into the community again. If you're waiting for COVID results, any test results, and often now when we're testing for COVID, we're testing for the flu as well. So if you're waiting for results, you know, don't risk it. If there's been a possible exposure, which means, you know, if you've come into contact with someone and then they gave you a call, hey, I got diagnosed, or my family got diagnosed with COVID, you know, that would be a reason to stay home as well. And then looking at this last one, persons with increased risk of severe illness. Now that's our elders. These are the people that we've been talking about, all the social isolation. So this is our chance to strike a balance. So a holiday event that follows the proper protocols can allow us to strike that balance for our elders so that they're not just stuck at home alone on Thanksgiving or the holidays. Oh, we went backwards again. There we go. All right, you guys. So, you know, social isolation and loneliness, you know, may not be as easily measurable as blood pressure or cholesterol, but they're health risks nonetheless. We need to pay attention to those. And we need to hone our toolkit so that we can support our elders who are extra isolated and extra lonely during this time. And with knowledge about COVID disease and proper protocols, find a balance for the holidays that allows for safety as well as connection. So that's my boy, Felix. He's 1.5. So now I think we're approaching the time for questions. I do have a reference slide, which can be available in other ways. I know it's a lot, but if you go one more, this is an email address that you can contact me, but please just don't put any personal health information in any email that you write, because it's not HIPAA compliant Gmail.
Wow, Dr. Keebler, that is a very generous offer to provide your contact information. Thank you so much. And thank you for sharing a photo of your son. He's really adorable. And I think that just shows us that you understand you're a parent along as you're a physician. And I'm sure that you have older family members who would love nothing more than to spend Thanksgiving with you and Felix. And so we understand that. So a reminder to everyone, go ahead and start dropping your questions for Dr. Keebler in the Q&A. We also send out a recording of the presentation the following week. So I see some people asking, you will get these slides and a recording next week. But please begin to add your questions to the Q&A so we can take advantage of this time. Now, Dr. Keebler, we've had a couple come in, and so there's sort of a general question around how do you support individuals who are bedridden? Those who are not able to go outside to meet you on their stoop, but they really can't move, but they could certainly benefit from some social engagement.
Really great question. I have a lot of bedbound patients, and it kind of depends on if they are completely bedbound. You know, bedbound patients can sometimes be transferred to wheelchairs with a Hoyer lift. If that has been explored, that, you know, that's a great option. So if that hasn't been explored, then a physical therapy consult can assist in assessing for transfers and if a Hoyer lift would work for them. That way we could get into a wheelchair and have a little bit more mobility. If a person is completely bedbound and absolutely cannot get up, that's really difficult. You know, ideally we'd be near a window. We would be able to, you know, access the sun and fresh air in that way. And that can also allow for outdoor visitors to come to the window. Which is really nice to see people in person. You have to be careful with that because a screen on a window is not the same as a mask. So we actually had an instance of coronavirus where the only way we could think of that the person got it was they were sung happy birthday through their window. And so we want to be careful and really cognizant of the droplet situation, you know, maybe keep the masks on, but some outdoor visits are really nice. And then of course the technology piece with a bedbound patient, that will likely involve a family or a caregiver facilitating that connection. And that's really what I'm hoping we can get a lot of staff and caregivers to start incorporating into a routine, is using technology to kind of facilitate that connection.
And it makes me think the sort of the many months we've been in this situation is it's almost like we should treat every client as if they are on hospice. And what I mean is hospice is designed to really meet everyone's total need, both pain and social engagement and family connection in innovative ways. They bring horses to the side of windows. They facilitate weddings in the backyard. You know, they really go the extra mile. And it feels like if we were to treat every situation with that same level of urgency and importance and creativity, that I think that we would be served well in this time, but likely always. So I appreciate your comments. So this is a really important one, and I think it relates both to those individuals who have a family member, an older adult at home, as well as someone in a facility, which is, do you have any recommendations for how families can sort of monitor possible situations like weight loss, skin integrity, if they are not able to join? And in California, you know, visitors have had the right to be entering facilities, and now that may change. So how can they monitor those important markers of care and health when they're not able to be there?
Oh, it's so hard. I work with my families on this too. Ideally, we have a trusting relationship with the facility staff and caregivers. That's obviously the best scenario. And then it's just up to knowing what questions to ask. What have the waits been? Most facilities will periodically weigh their residents. And so you can ask for a backlog, fax me over all of the weights. That's what I'll often ask for. What has their intake been? So facilities will often record what the intake is, a lot of kind of those daily habits of a person. So you could request those records. Enlisting the help of your doctor or the person's doctor will be really helpful because you might get a lot of information that you request. But I would say looking at the weights, looking at the intake, trying to do a video chat so you can see the person and see if you think they look any different. You might notice that they look thinner. You might notice that they look less alert, less stimulated.
Mm-hmm.
And then also, inquiring with the facility itself, the administrators, what their practices are in terms of getting the residents outside of their bedrooms. So a lot of these facilities do keep their residents kind of in their individual rooms, and that makes a lot of sense safety-wise. But when do they get a break from that?
Mm-hmm.
And if they don't, what can we do to make that happen for my loved one?
Mm-hmm.
Let me think of what else I can, the other things we talked about, like going over the medications is a huge one. So you could get a medication list and, ask the doctor to look over it. The doctor can ask the facility to get a set of vital signs and just kind of do kind of a virtual piecing together of a checkup in that way. Also, a lot of physicians, including at Kaiser, are doing video visits.
Mm-hmm.
So if that's something you want to do, then we could do a checkup that way. And then the other thing is that facilities will let doctors in. So
Mm-hmm.
if you're lucky enough to be in a service area where there is a home visit program,
Mm-hmm.
then the doctor could visit the patient in the facility. And sometimes you can sneak in a family member that
Mm-hmm.
way.
Yeah. And I wanted to offer that, and I speak to California, is if you're encountering challenges getting this information, or if you're encountering challenges setting up either the video chat or in-person visits where available, reach out to your long-term care ombudsman office. They can assist with that. And in California, we are doing in-person inside visits with PPE and lots of testing. And so I wanted to encourage folks, if they're encountering challenges and you feel like your spidey sense is telling you something's wrong, trust that, and you can call your local ombudsman's office. And I would also add that your best friend is the term care conference. And that's a great time to bring in the physician or the nurse practitioner and the ombudsman and really look at the situation with the resident and the family and the facility and see what is or is not working. And I think that's a great non-invasive, non-sort of adversarial way to address a situation that you see unfolding in a facility. Now, Dr. Keebler, I'm wondering if you have come across any specific recommendations or resources that you would recommend for LGBTQ plus seniors.
Oh, I wish I had more resources on that. I'm starting to build my list of resources for, our various patients. And the most I have right now is, like a website that I would have to go look up. But yeah, no, absolutely. These are really important to, focus on our patients as individuals and try to, cater our care towards, who the whole person is. And we know that our LGBT, elders are even more, have even more health gaps and difficulties than our other folks.
Absolutely. And I would add, and this may be true across the country, but in California, we have a significant population of individuals who don't have someone to name as their responsible party if they don't have capacity. And this sort of disproportionately impacts the LGBT population, because in California, more of us came out here to California, more people didn't have children in a general sense. And so we as a country need to be really addressing this issue. And I would just add a couple things here in the Bay Area, but it's a great website, is the Lavender Seniors. They have tremendous training for service providers about how to best engage this community, to be open, to not appear judgmental, and to really allow for that space to talk about their life experiences. So for those of you in the Bay Area or really all over, I would suggest the Lavender Seniors. They have some tremendous training resources.
I'm going to write that down. Thank you.
And I see we have some folks from that organization here. I want to encourage you to drop that in the chat for everyone to use. Again, we're a learning community for all of us. So this is a great one, is if you're, when you're having those video visits, or when you are able to visit with someone in person, how do you try to explain COVID to someone who is an older adult, particularly those who are experiencing the impacts of dementia?
Mm-hmm. Yes, I have a lot of patients with dementia. Some of them understand about COVID and some of them don't. Just like anything, with a person with dementia or some sort of cognitive impairment, we try our best to explain a situation, say COVID, and we use the same wording every time. So this is a great tip in general to communicate with people with dementia, especially those who might have repetitive questions that they ask you 10, 20 times a day, is to have kind of a canned response, the thing that you say every single time. And I think that benefits in two ways. One is, what you're going to say every time, and it can help the frustration level of the caregiver. And I think it really does help the person absorb the information when we repeat it, in the same way every time. Now, sometimes information just can't sink in. So a person with dementia might never understand, about masks or the other protocols. And in that case, we simply need to provide the supervision required, to help the person comply. A lot of people with dementia are not able to wear masks. And if that's the case, we have to work with that. And that might mean there are certain activities or certain things that just are not available to that person. So we need to think even more about what we can do. If this person can't wear masks, then, what can we do to accomplish what we need to, doing the distancing, or everyone around them is wearing a mask and, understands that risk. Mm-hmm. It's a hard one.
And I wonder if it's a question of understanding their level of anxiety. So if someone's really experiencing anxiety around wearing a mask, that may, we may not want to lean into that, but we might want to say, gosh, it's about all of us making sacrifices to protect, even younger children, or to keep everyone safe. And I think that that's a concept that can resonate, even if we may not understand the full breadth of the situation. And I also just think sometimes when the resident's really expressing confusion, sometimes just sitting with them and holding their hand and saying, like, it's hard, and I'm here with you, and just slowing down. I would also say when we go in facilities and we see the news on a lot that's constantly on churn about COVID, that we've seen that increased anxiety. And I think that's always something to watch out for. We have a really great question, actually, someone who I think is working in facilities, and they say, are there suggestions for meeting the emotional and psychological needs of the residents in long-term care, but as well as their family members? So how do we support those older adults who are in facilities and engage with them, but also, I think, address the increased anxiety and concern that their families are experiencing?
Oh my gosh, absolutely. Yeah. I mean, this is a huge issue right now. And, facilities previously at least, attempted to address these issues with the residents. They had communal dining and activities. Some facilities are having, kind of going with the tiers. So I had a patient who was attending outdoor small group exercise classes at their facility, which are now being revoked because of our purple status. But, I think, addressing the emotional distress of a resident as well as their families is such a huge undertaking, and it's really going to require that entire toolkit that we talked about. That's not a job for one person. That is a job for a team, and ideally a network of people and resources to address those. So it's almost as if each of those families needs a case manager to address that. But I think, and you, maybe Nicole, you can talk about where the ombudsman office comes into that, but I don't know if there is any entity that is really taking that on. Especially in the US, we're often kind of left to our own devices to take care of a lot of these types of issues, and they're not really addressed by large organizations or entities.
Yeah. And so I would say I'm going to give you all my secret weapon here. And I'm going to tell you, if you're in a community in the United States, you can call what's called your local area agency on aging, sometimes called the AAA, but it's not the one for your car. And this is a great tool that you can learn about what resources are available in your community for older adults and their caregivers. And I'm pleased in California, we have something called caregiver support. And those agencies are designed to work with caregivers to not only provide, sort of group kind of conversations and resources and tools, but they are an amazing resources for helping caregivers to understand how to navigate just the general world of caregiving and dementia, but especially during COVID. And so I always encourage people to contact your local area agency on aging. They all have resource lists. They're plugged into the community. They'll listen to you and help you understand what you need and provide you with information. And I also would like to say the Alzheimer's Association has tremendous support groups and information. So if you'll call the 800 number for Alzheimer's Association, they'll connect you directly with the chapter in your community. And they work closely with healthcare professionals, nonprofit organizations, and I think that they provide tremendous information. So Dr. Keebler, I was wondering if you could sort of give us your spidey sense for a second, because the question is really asking, are there universal screening tools that you can use to understand individual situation-related social isolation? And I know there's some great tools you'll probably suggest, but I also wonder if you as a physician have probably just developed some markers that you look for over the years, that if something is present, it makes you a little concerned and you start to look for ways to help that person engage with the broader community.
Yeah. So when I'm working with my elders, whether or not they have any memory impairment, I'm always speaking with a family member as well. So I would say, 99% of the time I'm speaking with more than one person, when I'm focusing on one individual, kind of getting a sense of what their support system looks like. Is the caregiver or family member engaged with you? When you're asking, how is this person doing? What's going on? Do they seem stressed or distracted? Do they have a job that they have to go to? Kind of assessing that caregiver health. Caregiver burden and caregiver strain are huge issues, but right now, I mean, it's monumental, how strained our caregivers are these days. There are tools to assess, and actually, like a questionnaire you can give a caregiver to assess whether or not, how severe their caregiver burden is. And we use those sometimes. But I think just even talking to them and getting that sense. And then, we talked about some of those issues before. Let's see, are they having, is the elder having any symptoms that, might be indicative of an underlying problem? Are we falling more? Are we more withdrawn? And or having more memory complaints?
Excellent. So I have kind of a quick question, then we're going to dive into one last serious one. And so someone asked, for seniors who can't wear a mask, would wearing a shield help?
I think it would help, but it's not going to be the same.
Okay, that's great to know. Thank you.
I think it's worth trying, and something that won't be upsetting to the person, would be helpful, better than nothing.
Excellent. Now, this is a really important question, and I think it gets to the heart of what we were trying to discuss today. Because, originally we were going to call this webinar, Put Your Seatbelt On First, because we realized that caregivers are the key to preventing senior isolation. So we have Sylvia, who's a tremendous ombudsman in Ventura County. She says that they're encountering a tremendous amount of grief and loss from family members who have, their resident has passed away during the last 8 months when they were unable to see them. So can you talk to us about ways that we can support the caregivers who are experiencing grief because they've lost someone or because they can't see them? How can we help the caregiver?
No, that's a really great question. So, unfortunately, a lot of people have passed either from COVID or something else and have been unable to spend time with their families in their last days or even weeks. Some people have passed in the hospital and their families had to say goodbye over FaceTime because of the visitor restrictions. And it's very tragic and very traumatic for the families. So we always want to think about the family when a person passes and how they carry that forward. I would say first of all, the most important thing that any of us can do is listen. I think it's really important to process, something like that happened to a person, allow them to express whatever is going on in their minds, whether it's how they're feeling or if they just want to talk about what happened or what their frustrations were. There's often a lot of frustration with, the staff wouldn't let me see mom or, they wouldn't do for us. And I think it's really important for people to be heard when they feel that something could have been better, and facilitate, if they are interested, providing feedback to whatever, if it's a facility or a hospital, providing feedback to the appropriate channel. So that could be the facility itself, member services, or even the ombudsman office, to make those voices heard. And then on top of that, I want I'm sure everyone knows this, but hospice, if a person's on hospice, there is that bereavement benefit for the family. And I believe it lasts a year. And so that is counseling that's available to the families after the person has passed. So I really think us, being able to listen and referring to a counseling or, grief counseling or even just therapy, whether or not they're on hospice, would be really helpful, because these are traumatic events that are happening, and people have to live with that.
Absolutely agree. So one last question, it's actually to you personally. So as a professional who works with older adults and families, what one thing are you doing to take care of yourself during this time that maybe we can learn from? What self-care tactics are you using as a professional?
So as a healthcare professional, and I'm sure a lot of us can relate to this, I am a perfectionist. I'm type A. I hold myself to a very high standard, and I like to do good work, and I know all of us here share that. And one thing that I've been doing, which has taken me 9 months of the pandemic to do, but I'm really trying to be more kind to myself and allow myself some wiggle room. So just little stuff like, doing my documentation. It can be done the next day. Figuring out where you can give yourself a little bit of breathing room. If I walk by the pile of dirty dishes in the kitchen, I used to feel compelled, to take care of it. And now I say, what do I want right now? I don't want to do that. I want to watch TV. And so I'm letting myself do that. Another really important thing that I've done in the past, I would say month and a half, is I've actually reached out for help myself. So, I reached out to, Kaiser, my employer has resources available to employees for support. And I have participated in those myself and really found it incredibly helpful. And I just can't tell you how helpful that has been. So really looking at yourself with that same compassion that you share with all of your clients and patients, is hugely important.
Excellent. Thank you for sharing that. I think that's very brave and important for all of us to hear, that we need to take care of ourselves. And so to everyone else, I want to thank you for joining us today. I want to remind you that our next webinar will be on the second Thursday of every month, next month. It's a week early, so hopefully you can maybe celebrate a little holiday. We'll be joined by Miriam Elman-Shawi. She is the executive director at the McGeorge Law Institute for Victims, and she's going to talk to us about victims' right and Marcy's Law. We're really excited to have her. I hope you all have a very happy but socially distanced Thanksgiving, and we will see you back here next month. Thank you, Dr. Keebler.
Thank you so much.